Hello friends, I hope you all are fine. Here I again welcoming you on our YouTube channel Shree Swaminarayan Physiotherapy College Rani. Myself Dr. Jemeesha Panchal want to discuss with you about the varicose vein. But before I start, please do not forget to like, share and subscribe our channel for further update. So, what is varicose vein? It is also called spider veins. It just be a cosmetic concern for some individuals. The second one is dilated tortuous superficial veins that mostly seen in the lower limb. However, in that case, it may symptoms ranging from pain to ulcers that require prompt treatments and medical interventions. Have you ever checked this out? Then let's check it out. It happens because of weak or damaged valves. When muscle contraction occurs, the valve does not close the vein properly and blood flow get affected. It's called venous insufficiency. There are many other causes that leads to varicose vein like overweight, that puberty age hormonal imbalance, then prolonged standing occupation like nurse, teacher, hairstylist, factory workers, etc. Then in pregnancy, menopause, then patient having constipation, then any malignant condition, then lastly it may be due to heredity. Now let's see the symptoms. The veins are become blue or dark purple. Then it look also twisted, swollen and bulgy like appearance. The ankle becomes swollen. Then there may be a shiny skin discoloration near that area. Then other person having problems of heavy legs, especially after exercises or at night. Then higher percentage of people with varicose vein also having restless leg syndrome. While suddenly standing up from the sitting position, some individual also experience the leg cramp. So now let's see the preventive measure. If you have an initial stage of varicose vein, then we can prevent it by following these steps and reduce the risk of developing the worsen stage. For that, you have to do walking every day for at least 30 minutes. Then take the healthy food and maintain your weight. The other one is avoid standing still longer period of time. Then do not sit with crossed legs. Then lastly, sit or sleep with your feet should be raised on the pillow. So, if the patient has no symptom or discomfort and is not bothered by the sight of the varicose vein, then treatment might not be necessary. There are many different treatments available for varicose vein. It is based upon the presence of different symptoms, size and location of the varicose vein. If I talk about the surgery procedure, individual may go for sclerotherapy or dissection of abnormal veins with technique using laser and radio frequency. But here I will discuss about the physiotherapy treatment. In that you have to do leg elevation, then wear the compression stockings to improve blood circulation in lower limbs. Then also walking, running, ride the bicycle and keep your lower leg active. So let's move to the exercise part. First, we will do the ankle pump movement. Sitting or lying down on your back and pull your toes up toward your head. Then point your toes in the downward direction. This exercise will help to improve the blood circulation and reduce the swelling. Do this exercise with both the ankle at same times and repeat it for 10 to 15 times 1 hourly. But do not hold your breath. The second one is leg lifts. As you can see in the video, lie down on your back with your feet straight. Slowly lift your one leg at a time from the floor and hold this leg in the air letting the blood run down, and slowly lower your leg back to the floor. Repeat it on the opposite side and do it for 10 to 15 times. The third one is bicycle legs. Lie down on your back, bring your both the legs in the air and bending them from your knees. Then slowly begin to pedal your leg as if you were riding a bicycle. Do it for 20 to 30 seconds for 3 times. The fourth one is leg up the wall. It gives a lot of benefits like it regulates the blood flow, improve digestion, and also restore the tired feet or legs, and lastly it relieves the swelling from ankle. As the exercise name suggests, you can see in the video and lie down on your back and take the support of wall. Hold it for 3 to 5 minutes and repeat it for 5 times. The fifth one is calf raise. In that you have to hold something for support like a chair, table or stand by the wall with one hand on the wall. Stand with your legs straight, then slowly raise onto your tiptoes, then come back on the floor. You can do this exercise in sitting position, standing position, and also in one leg. Do it for 20 times. The sixth one is lunges. In that you have to move your legs apart in standing position, then step forward and slowly bend your knee. Hold this position for 5 to 10 seconds and then slowly straighten your leg and step back to your original position. Repeat it on the opposite side and do it for 10 to 15 times. The last one is calf stretch. You can do it self stretch in sitting or standing position. In sitting position, keep your legs straight from the knee and touch your toes. In standing position, take the support of chair or wall and stand few inches away from the wall or chair. Then take the one leg, step back and flex your forward leg. You can see in the video and hold this position for 30 seconds and do it for 3 times alternately. And lastly, I will give some home advices to keep you healthy and prevent the disease and also reduce the risk of developing the disease. You can take a note of it. Thank you so much, guys. Take care.